Go to a mirror right now. Open your mouth wide and stick out your tongue. Look at its color, its texture, its coating. What you see is one of the fastest, most reliable health checkpoints your body gives you, and almost nobody over 60 is using it. Your tongue changes color, shape, and texture in response to what is happening inside your body, often days or weeks before you feel any other symptoms.
My name is Dr. Michael Williams. Here are 7 tongue colors and what each one is trying to tell you. This could catch something early that saves you a serious health scare. Color number 1, a pale, almost white tongue. A healthy tongue should be pink. If yours looks washed out, pale, or almost white across the entire surface, your body may not be
carrying enough oxygen in your blood. The two most common reasons in seniors are iron deficiency anemia and vitamin B12 deficiency. Both cause your red blood cell count or quality to drop, and one of the first places this shows is your tongue, because the tongue has an extremely rich blood supply close to the surface. Iron deficiency is common in seniors due to poor absorption, medications that irritate the stomach lining, or slow internal bleeding that you may not even be aware of. B12 deficiency is widespread after 60 because the stomach produces less of the acid needed to extract B12 from food. A simple complete blood count and B12 level test can identify both within a day. If your tongue is pale and you have been feeling unusually tired, short of breath on exertion, or lightheaded, get that blood work done this week. Color number 2, a bright red or beefy tongue. If your tongue has shifted from its normal pink to an unusually vivid red, especially if the surface looks smooth and glossy instead of having its normal slightly rough texture, this is a strong indicator of B vitamin deficiencies, particularly B12, B9 folate, or B3 niacin. When these vitamins are severely depleted, the tiny bumps on your tongue, called papillae, begin to flatten and disappear, leaving a smooth, shiny red surface that often burns or feels sore when you eat acidic or spicy foods. In older adults, a smooth red tongue can also signal an autoimmune condition called pernicious anemia, where the body attacks the cells in the stomach that produce a protein needed to absorb B12. This condition is treatable but must be identified. If your tongue is unusually red and smooth, do not dismiss it as irritation. Ask your doctor for a full B vitamin panel. Color number 3, a yellow coating on the tongue. A thin yellow film across the surface of your tongue typically points to one of two things. The first and less serious cause is bacterial overgrowth. When oral hygiene slips, bacteria accumulate on the papillae and produce a yellowish coating. This is common in seniors who take medications that cause dry mouth, because saliva is your mouth's natural cleaning system. Less saliva means more bacterial buildup. The second and more concerning cause is liver or gallbladder dysfunction. When the liver is not processing bilirubin efficiently, a yellowish tint can appear on the tongue before it becomes visible in the eyes or skin. If your tongue has a persistent yellow coating that does not improve with better brushing and hydration, and especially if you notice any yellowing of the whites of your eyes, fatigue, dark urine, or discomfort in your upper right abdomen, get your liver function tested. A basic liver panel is a simple blood test that your doctor can order immediately. Color number 4, a white patchy tongue with raised areas. This is different from a uniformly pale tongue. If you see distinct white patches on your tongue that look thick, slightly raised, and cannot be scraped off with your toothbrush, this is a condition called leukoplakia. In most cases, leukoplakia is benign irritation from rough teeth, ill-fitting dentures, or tobacco use. However, in a small but clinically significant percentage of cases, leukoplakia is a precancerous change in the tissue. Any white patch on the tongue that persists for more than 2 weeks and cannot be wiped away should be examined by a dentist or doctor. This is not something to monitor from home for months. 2 weeks is the guideline. If it is still there after 2 weeks, get it looked at. Early detection of oral precancers is straightforward, and the outcomes with early treatment are excellent. Waiting is where the risk lives. If the white patches can be scraped off and leave a red or raw surface underneath, that is more likely oral thrush, a fungal infection caused by Candida overgrowth. Thrush is extremely common in seniors who use inhaled corticosteroids for asthma or COPD, who take antibiotics frequently, who have diabetes frequently, who have diabetes, or who have dry mouth from medications. Thrush is easily treatable with antifungal medication, but it does need to be treated because it can spread to your throat and esophagus if ignored. Color number 5, a dark brown or black tongue. This looks alarming, and understandably so. But in most cases, a dark brown or black appearance on the tongue is a harmless condition called black hairy tongue. The papillae on the tongue grow longer than normal and trap bacteria, food particles, and dead cells, which create a dark discoloration that can look genuinely frightening. The most common triggers in seniors are antibiotics that disrupt oral bacteria balance, bismuth-containing medications like Pepto-Bismol, excessive coffee or tea drinking, smoking, and poor oral hygiene combined with dry mouth. In nearly all cases, it resolves with improved tongue brushing, hydration, and time. However, and this is important, if the dark discoloration appears as a single defined spot or patch rather than a general darkening of the surface, particularly if it is very dark brown or black and does not change over 2 weeks, have it evaluated. Isolated dark spots can occasionally indicate melanoma or other concerning changes that need professional assessment. Color number 6, a blue or purple tongue. If your tongue has a bluish or purplish tint, this is a sign your blood is not carrying enough oxygen, a condition called cyanosis. In seniors, the most common causes are chronic lung disease, like COPD or emphysema, heart conditions that reduce the heart's ability to oxygenate blood effectively, and circulation problems. A blue tongue is not subtle. When you see it, you know something is off. If you notice a bluish color on your tongue, your lips, or your fingernail beds, especially if you are also experiencing shortness of breath, this needs prompt medical evaluation. It indicates that your oxygen saturation may be dangerously low, and that requires investigation to identify whether the problem is pulmonary, cardiac, or circulatory. Color number 7, a grayish tongue with a thick coating. A heavy gray coating on the tongue that looks dense and feels like it is sitting on top of the surface is uncommon, but worth knowing about. It can indicate a long-standing digestive issue, chronic dehydration, or in some cases, a condition called lichen planus, an autoimmune-related inflammatory condition that affects mucous membranes, including the tongue and inner cheeks. In seniors who have been on multiple medications for years, particularly those taking several that cause dry mouth, a thick gray coating can also develop as a result of severely reduced saliva production, allowing dead cells and debris to accumulate faster than the body can shed them. If a gray coating persists despite improved hydration and oral hygiene, see your doctor to rule out underlying immune or digestive issues. Here is what I want you to do with this information. Check your tongue every morning when you brush your teeth. It takes 3 seconds. You are already standing at the mirror. Open your mouth, look at the color, note any changes. If something looks different from your normal pink, give it a week of good hydration and thorough tongue brushing. If it persists beyond 2 weeks, bring it up with your doctor or dentist. Your tongue is one of the few organs you can examine yourself, for free, every single day, with no equipment and no appointment. Use it. It is giving you information. Most people just never learned how to read it. Now you know. If this was useful, subscribe. I put out new senior health videos every week that give you real, practical information you can actually use. Share this with someone who needs to see it. I am Dr. Michael Williams. Check your tongue tomorrow morning, and I will see you in the next one.